because some are not visible on one slide and the other is visible on the other. Okay, so we will start with the layers. When I say layers, the wall first. Okay, the eye would have several layers in the wall. Okay, so the one that is visible to us would be the corneoscleral coat, okay, which is this one. So this is the one that you would see, okay, to your classmates, okay, the cornea, this one, which is transparent, and the white portion is the sclera, okay, and then we have a middle layer, which would be composed of the vascular coat, okay, and this would comprise the iris, the choroid, and then we have the ciliary body. Okay. And then the inner layer would be composed of the retina, this particular area. This particular slide would show better orientation with regards to the layers kasi smaller siya. So we go into the cornea first. So the cornea would show the 5 layers. Okay? So the outer would be lined by stratified squamous epithelium. So this is the corneal epithelium. Okay? That is non-keratinized. So in the moving exam, you have to specifically write there the non-keratinized word. And then underneath, you have the lamina for the epithelium, which is called the Bowman's membrane. You have the corneal stroma underneath, and then on the other side, you have the endothelium, the corneal endothelium here, and then underneath you have the lamina, which is the Descemet's membrane. Okay. So we proceed with the different chambers. Okay. Posterior to the cornea would be the anterior chamber. It is situated between the cornea as well as that of the lens. We have the posterior chamber, which is situated between the iris, okay, or underneath the iris and the lens. Okay. So the separation between this particular area would be the sonular fibers. Okay. So this would be the posterior chamber. So both chambers would contain the aqueous humor. With regards to the posterior chamber, with regards to the posterior-most chamber, we call it as the vitreous chamber. Okay, and it holds the vitreous humor. So this is a gelatinous fluid, okay, which serves to be as a shock absorber of the lens, of the eye. So next thing, we go to the iris. Okay. So the iris would support the pupil. Okay, as you can see, this is there is some changes in the appearance of the lens. The lens should be located posterior to the iris margin, okay? Because in between the iris would be the pupil, okay? And the pupil is what we would see when we are going to examine our patients. So it would either be smaller or bigger, depending on the intensity of the light, because the iris would control the size of the pupil, okay? So the iris would contain two muscles. We have the dilator and then the sphincter. Okay. So again, the pupil would be the opening here, okay, that would serve to act as the focal aperture controller or regulator, depending on the intensity of the light. So this big one is the lens, which is crystalline, and it is supported by the sonular fibers. So with regards to the the humor, the aqueous humor, we have at the irido corneal angle the presence of a small canal, okay, a tributary, and this is called the canal of Schlemm. Okay. So this is where the aqueous humor would pass through. Lining the iris would be the presence of a myoepithelium, okay, and it is pigmented. We have the ciliary body, which will be composed of several ciliary processes. Okay. Its function is mainly to produce the aqueous humor, as well as to serve as point of attachment of the zonular fibers, although in this case, there has been disruption of its attachment. So you can see that the iris as well as that of the ciliary processes are pigmented, so they contain the melanin. Okay, and then we go to the choroid, which would be continuous, okay, up to the area of the optic nerve. Okay, so we can see that in this particular area we do not have the choroid. So the choroid would be the source of blood for the retina. Okay, so it would serve to support the retina. And you can see here the choroid, and this would be the retina. And I would see some difficulty in identifying for the correctness of the layers. We have here the choroid. This one, I'm not sure if we can identify for the rods and cones. Okay, but on the other slide, we would be able to identify. So we have the nuclear layers over here. We have the ganglion. Okay, and then we have the limiting membrane. So we have the presence of, I think this would be for the optic nerve layer. Okay, but you try to differentiate this particular layer with the older slide, which I'm going to discuss later. Okay, and then we have the optic nerve here. Okay, so we would see the optic nerve at the posterior most portion of the eye. Okay. We go now to the older slide, and just to show you the layers of the retina. So as you can see, the organization of this particular slide is different from that one, in a sense that you do not see clearly the cornea. Okay? This is actually the cornea, but it has a different color. Okay? So this would be the iris, this would be the lens, the ciliary body. We have the choroid, which is easily identifiable because of its color. So you have to follow the ciliary, the choroid, in order to look for the portion of the retina. So this is the retina. We look into the high power magnification. So as you can see, this particular portion is the choroid. Okay. This one is so this one is the RPE, the retinal pigment epithelium. Okay. This one would be the rods and cones. We have the outer limiting membrane. We have the outer nuclear layer. You have here the outer plexiform, inner nuclear, inner plexiform. We have here the ganglion, and then up to that point, easily identifiable, but later here we have the next is the optic nerve, and the inner limiting membrane is not that identifiable. But for this particular area, you would easily identify the layers compared to the previous slide. Okay? So, and then we have the human eyelid slide. So for girls, I think this is the trend. Am I correct?
For Kuya James.
Okay, so yung iba sa inyo, ito pinapa-extend. So we have the outer conjunctiva and the inner conjunctiva. Ito yung inner pala. This is the outer. Okay. This would be lined by stratified squamous epithelium. We have here the hair follicle. Okay. And then here you have the lining epithelium, which can be columnar, okay, to stratified. You have the meibomian glands, which are actually sebaceous glands. You have the orbicularis oculi here. If you encounter the presence of a crying glands here, or sweat glands, we call it as the sweat glands of Moll. So yun lang naman yung nandito. Okay? And then we have the lacrimal gland. So for the lacrimal gland, its appearance similar to that of the breast tissue, wherein you have a lot of tubulo-acinar glands, yan sila lahat. Okay. You have okay, so you have here some of the intralobular duct. Okay. And this is the interlobular duct. Okay? So intralobular duct, interlobular duct. Okay? Then we go to the cochlea. So ganda na to. Okay, so the cochlea would show three types of ducts. Okay, so we have one duct which is endolymph containing, and then we have two ducts that are perilymph containing. This is the helicotrema, which is the apex. Okay, and you focus your study on this particular area. Okay, for this particular area. So the innervation of the cochlea would be cranial nerve 8. Okay, so we have the vestibulocochlear nerve, and we have here the ganglion cells, which would be the representation of the cranial nerve. Okay, we have the ganglion cells. So this would be the orientation, the same lang dito sa kabilang side. Okay, so this would be the one of the duct, another duct, another duct. Okay, and the lymph, perilymph. Okay, scala vestibuli, or this is a scala tympani. If you are going to go to America, they would call this one as the scala vestibuli. Okay. Ito naman, scala tympani. Okay. And then here in the middle, you have the organ of Corti. Okay. Yeah, organ of Corti dito. Pero if you are going to America, they are going to tell you, this is the organ of Corti. So the scala vestibuli and scala tympani would contain the perilymph. Scala media would contain the endolymph. And then we have the boundaries of the scala media. Okay. We have the Reisner's membrane. Okay. We have the basilar membrane. Boundaries on the lateral side, we have the cilia vascularis. Okay, okay,
Sama
which would be the source of heat and the lift. And then you have the spiraling event on this side. The modulus would serve as the bone, okay? That would be at the center. So next we go to the organ of Corti. So the organ of Corti, okay, would have its floor. This is the pectoral membrane. Okay? We have several hair cells here. Okay? Basta yung nasa pinakaharapan is the hair cell. Underneath we have the supporting cells. Okay? So they would possess stereocilia. However, sometimes the stereocilia is not visible. Okay? Kasi napuputol. But they are the ones that are responsible for the formation of sound. So the pectoral membrane and the basilar membrane, they would, in the presence of vibration, okay, they would vibrate and then they will transmit the sound waves into the hair cells. So I think that's it. Do you have any question? If there's none, you kindly borrow your slides. Okay.